Happy Thursday, Doc.
Hi, Miranda. How are you?
I'm doing good. It's our Friday today.
It is.
And it's gorgeous out.
It's been a good week.
It has been.
It's been a good week. You want to chat?
Sure.
Okay. Let's go to another room.
Sure.
We're always talking here when you catch me between patients. Thought maybe we could talk about maybe some of the things that we'll see patients report back to us when they start getting adjusted. Maybe that they're not really expecting to have improvements with. So let's say, you know, the vast majority of people come to see us because they've got something wrong with their back and neck. They have some kind of pain. Maybe they've got range of motion issues. Their balance is off. Maybe they've had an acute injury or like a chronic problem that's been going on for a long time. And those are bread and butter chiropractic kind of treatments. And we help with that a lot. And then after a few visits, you know, I'll be asking them, like, what are you noticing? Like, what's going on with your body? What do you feel? How are things improving? How are things changing? And we'll quite frequently see patients report back that they're noticing changes in their body that they weren't really expecting. So let's use the example of someone who's been having like some neck, upper back pain. And it's been bugging them for maybe a couple of years. And they come in, they start getting adjusted, they start feeling better, which is what we would expect. But then they say, you know what, I've noticed I'm sleeping better. My mood has improved. I feel like I have more energy. A lot of patients report that things just kind of seem more clear when they've been getting adjusted and the right alignment. And that makes sense because when our joints are functioning well in the spine in particular, those joints are attached to a lot of really important nerves that leave the spine, and that means our nervous system might be affected for better or for worse depending on what's going on with the alignment. So things like problems with energy, fatigue, sleeping issues, they might improve pretty significantly once you start getting adjusted. And it's not that there's an adjustment that helps with sleep or an adjustment that helps with energy, but if you keep the spine functioning well, the rest of the body functions well too. And we'll see other examples of that. If someone's been sick for a while and they feel like their immune system is suppressed, adjustments can keep things in the right alignment that help with the nerves that go to our organs responsible for our immunity. And that's going to help a lot.
Yeah.
A lot of patients with lower back issues might report that they feel like their digestive system does not work the way it's supposed to work when their back is out, so to speak. And once they start getting adjusted, they feel a heck of a lot better. If you've ever seen a baby with colic.
I was just going to say, we've done some baby adjustments where it's been pretty immediate response.
Right, yeah, and that baby can't say that their back hurts, but they are gassy and they're colicky and they don't feel good, and then the rest of the family doesn't feel good either because of that.
Right.
Once we start doing some, you know, really gentle specific adjustments with the babies, guess what goes away? The colic. And their back starts to work better, they get better mechanics in their back and neck, and things improve. So that's just one of the examples of how the health of the spine really affects the health of the rest of the body. And the more we keep the spine healthy, that gives the body a better chance to do what it's supposed to do.
Well, that's pretty awesome.
Cool. Thanks, Miranda.
Thanks, Doc.